So how did you start all this? I mean, at some point you were here, you're an obstetrician, gynecologist, and you're interested in some research and things, and you wandered into Worcester. So is that where you, I mean, how did you get from all of this to Worcester, and what did you do over there, and how did that lead you to coming to
the medical society?
To the medical society as a whole?
Yeah, well, there are two things. I mean, there's my track to the medical society, and then there's my initial practice, clinical practice of medicine. As I finished my residency, which I did at Case Western Reserve in Cleveland, and that was in 1979, and the word from the people I admired the most, my instructors and teachers, was that solo practice and private practice were things of the past, that the future belonged to multi-specialty groups. And so in looking at different practices, I focused on opportunities that I felt held a future for me. I looked at locations that I felt would allow me to practice using all the skill that I had acquired as a resident, but also would allow me to learn more, because I knew medicine was changing and I needed to be able to change with it. So I looked at a bunch of different locations, and I landed in Worcester, Massachusetts at the Fallon Clinic. It was a forward-thinking, multi-specialty group. They had recently started a health maintenance organization, and the medical school was there. The specialty of obstetrics and gynecology was not so developed in the academic department that I would find myself having to refer all of my interesting patients into the center. The people there, in fact, welcomed collaboration. And so I checked off a bunch of boxes with that and joined the Fallon Clinic. After a few years, I would say that what I learned about myself was that I felt responsible for everything, and I wanted to be in control of everything. If the phone wasn't getting picked up, if somebody couldn't get an appointment, if the lab work wasn't getting in the chart, every little detail I felt was my responsibility in one way or another. And large organizations aren't configured to allow someone that much autonomy. So I went to the other extreme. After 4 years of that, I opened up a solo practice a couple of miles away in Shrewsbury, Massachusetts, and basically spent the next 30 years or so practicing either in solo practice or with a partner. I had a brief foray back into a multi-specialty group in the late 90s, but basically I discovered the same thing about myself and about big organizations. And for me, the translation was I felt the greatest satisfaction putting myself in a situation where I was managing every detail.
But then you chose to come to the Massachusetts Medical Society, and that's a big organization.
It's a big organization,
So
right. And
you didn't learn your lesson, I think.
well, I will say when I joined the Fallon Clinic, they had a long tradition of being active in the medical society. And so one thing they told me, and I was grateful for that, was, we all joined the medical society, and you might want to as well. And I did. And then I was drawn in by a senior colleague named Leonard Morse, who recommended that I become more active and become a delegate to the Massachusetts Medical Society, which I did. But I have to say that got me to the meetings, but it didn't engage me, that I'm not a parliamentarian. I don't enjoy long hours of listening to deliberations and debates. And I showed up at all the meetings, but I can't say my heart was in it. But it exposed me enough to staff and colleagues that when this Committee on the Quality of Medical Practice was initiated, my name came up, and Alan Gorel appointed me in 1997 to chair that. And that is what drew me into the organization.
Your rise in the association was quite brisk. And I think it was not only the times, but it was your skill. And it was appreciated very quickly that you were needed here. And you've done a great job.
I think the strength of the organization is that at least the opportunities I had, I put energy in and I saw something happen. I think that if you apply yourself, if you press the button and nothing happens, eventually you stop pressing the button. And so the strength of the organization is to be able to capitalize on the energy and the perspective and the talents of the people who belong to it, and turn that into making a difference.
I agree with you.
Yeah.
And I think in the old days, a person would have to be around for oftentimes for years before they would be given the responsibility of being president of this organization, and many like it. But I think you're an example of the change that's occurred, where you have special skills for special times. It's appreciated, and you don't have to have hung around for 20 years before you're given major responsibilities.
Yeah.
And I think you are an example of that, frankly.
Yeah, I feel fortunate. As I say, it was the moment from my point of view more than anything else. And
So one of your role models was Leonard Morse. And
Right.
that leads my thinking in two different directions.
Okay.
One is public health.
Yes.
Yeah. So you were in charge of public health in Worcester for a while. You followed
Right.
in Leonard's footsteps. Well, tell us
Right.
about that.
Well, Leonard Morse is an interesting individual in so many ways. Just brilliant and insightful, critical thinking, creativity. He just is an incredible presence, and his abilities to think creatively and to find solutions where people didn't see anything have always amazed me. I first learned about him when I was a first-year student in medical school, and I was taking epidemiology, and one of the case studies in epidemiology was the Holy Cross Hepatitis epidemic of 1969, I think it was. And he had performed an investigation that was incredibly brilliant from the point of view of connecting the fact that the football team was drinking from a water fountain that was being fed by a pipe that went through the irrigation system to the football field, that was visited by some children in the neighborhood nearby that had hepatitis, and not all of them made it to the bathroom on time. And so what ended up happening was the entire football team ended their season, and he tracked that down. And just if you think of the line of thinking that would lead someone to that sort of discovery, it's brilliant. That is only one of many stories about him. He practiced solo practice. He was an internist. He specialized in, or subspecialized in infectious disease. And at a time when there was very little in the way of resources for the Department of Public Health in Worcester, he became the go-to physician to help them with investigations. Later on, when a colleague of his retired as commissioner, he took that on for a decade. And as he was readying for retirement from being commissioner of public health, I had been working in infant mortality in Worcester, trying to track the high incidence of infant mortality compared to other towns, and working with a committee that looked into that. I reviewed every infant death and stillbirth. Actually, I was active in that for many years. I reviewed every infant death and stillbirth for about 17 years. Built a database, provided reports and analytics, and that got me involved with public health in Worcester more than I ordinarily would have been. That plus my background in being interested in electronic medical records and some perception of health policy and the fact that there are ways to improve the health of a community above and beyond the physician-patient relationship. And that if we are looking for ways to better the health of the community as well as control costs, we should think about expanding the scope of public health in finding ways to integrate public health with medical practice. So it was that line of thinking that led me to interview for the position of Commissioner of Public Health in Worcester. And I was selected for that position. I got myself immersed in it quite intensely right from the start, trying to build connections between the data collection systems with the hospitals and the Department of Public Health at Massachusetts and with a data system we had, as well as dealing with other aspects that I thought would be creative. But I will also say that again, implementation is the big thing, as you said. Organizations have cultures, and changing a culture is a few ticks above impossible. So I found myself in an organization that was not one in which I was comfortable, and I gave it a year of intense work, and at the end of a year it was very clear to me that my approach to public health and what they were interested in or were used to were different. And I did not feel that continuing was a good idea, so I resigned.
So just in a few minutes, you painted a picture of yourself as a human being that has broad interests in the total picture of health.
Sure.
From public health to individual health to women's health to data collection to electronic medical records. You've had a tootsie in about everything I can imagine.
One more, and that's public schools.
I've got one more after that, too.
Okay.
Tell us about the public schools.
Well, when I finished my year at the Medical Society, again, looking for something in addition to do, I had, with the work I had done with infant mortality and stratifying the groups and slicing and dicing the data every way I could think of, the one area that was just startling to me was the difference in outcomes between women who had a college degree and women who had dropped out of high school. And it occurred to me that when you looked at the two groups, the rate of poverty, the rate of illness, the rate of substance use, smoking, single parenthood, starkly different if you just divided by that one thing. And so it occurred to me that one lever that a community could have to improve its health would be to find ways to improve the education of its citizens. And so that got me thinking more about education. And an opening occurred in the school committee in Shrewsbury, and so I ran for that. And have been working there, bringing the perspective of a physician to education, both from the point of view of bettering the community and bettering the community's health, as well as a number of medical issues do come up. And I'm able to give some perspective on that. So I'm just starting my fourth term, actually, in that role.